as we know, I mean, HIF-2 inhibitors are a critical tool in the treatment of clear cell renal cell carcinoma, starting with the treatment of von Hippel-Lindau disease, and then we had data with the sporadic clear cell with belzutifan. And belzutifan is FDA approved and is certainly part of the armamentarium. But just as we have multiple VEGF TKIs, there's been a lot of interest in developing other HIF-2 inhibitors. And among those that have been developed, Casdatifan is the one sort of furthest along. So we saw single agent activity with Casdatifan with a pretty low PDS best response rate, distinguish it from some of the others. And so given that activity and then the encouraged responses of Cabozantinib with belzutifan in the past, there was an opportunity to say, can we combine these agents together, whether it be synergy or at a minimum, by giving that VEGF TKI, can we allow time for the HIF-2 inhibitor to work in those patients that may not have a slower time to recover? So that was the basis for this cohort. So it's only 24 patients, albeit small numbers. But the beautiful thing about HIF-2 inhibitors is they can be combined regularly because they have very different toxicity profiles from TKI. You don't have to deal with the diarrhea or the liver function test. So they pair well. So this was Casdatifan at 100 milligrams with full dose cabozantinib, just 24 patients, very short follow-up, less than 6 months. But at the time of analysis, 19 and 24 patients remained on therapy with very encouraging efficacy. And if you look at the waterfall plot, majority of patients have tumor shrinkage at this early time point. And notably, there's really nothing concerning from a toxicity standpoint, right? So if we look at the toxicities, we don't see any additive effect. As to be expected, the major toxicity is anemia, and that is an on-target effect from any HIF-2 inhibitor. And that can be managed with dose holds and often even the use of ESAs, provided the iron stores replete. Low doses of erythropoietin actually sort of overcome that and allow to maintain dose intensity and density. So I think it's really exciting early data for this combination. The data is quite encouraging, especially given what we know about combined TKIs with HIF-2s in other trials. As you look forward to the data for lenvatinib and belzutifan versus Cabo. So that trial is going to be, looking at two different TKIs, one with belzutifan, one without. PEAK-1's a much cleaner design that's really trying to say what is the benefit of earlier treatment with a HIF-2 inhibitor with TKI. So that's the basis. So patients who progress on immune checkpoint blockade, who have not received Cabo, are going to be randomized to either cabozantinib alone, with or without Casdatifan. I think it'll be really help answer some of these questions about how best to use HIF-2 inhibitors and attempt to, again, ensure that all patients get these drugs and use them earlier in the disease course.